the list. And we'll just, whatever.
Everyone has a phone.
So, muscle of the forehead here is the frontalis. Now, this muscle you can contract by itself. And when it does, it raises your eyebrows. Okay? But there's this whole fascia on the top of your skull. It is called the epicranial aponeurosis. An aponeurosis is a very thin, fibrous sheath that connects usually a muscle to a muscle. And you have several in the body. But this is a big one up here. And it runs from the frontalis to a tiny little muscle here in the back called the occipitalis. And if both of these muscles contract, your entire skull or scalp moves back and forth. We can usually see it better in guys because they usually have less hair. Can you do yours, Jeff? Can you move your scalp back and forth? Can you feel it move a little? There we go. There he's moving it.
Actually,
yeah.
I thought you were like
no,
muscle mover.
Well, some people can actually, it really moves, but it's hard to do. Right? Okay. So those are those two muscles. A lot of times they're given a huge name all by itself. I like to pin everything separately. So I would pin frontalis, occipitalis, and the epicranius aponeurosis.
That's spelled out somewhere in the book.
Epicranial, easy, and then ap for neurosis, like an apron, in a sense. All right, big muscle here. Temporalis. You can feel this muscle here. This is called a synergist with your zygomaticus. So there's a zygomaticus major and there's a zygomaticus minor. You see these two pieces here? Mm-hmm. And when they merge, then it's called the zygomaticus. I like to pin where it's merged. Historically in the body, minors are always superior to majors. If you remember that, that will help you. So when this muscle contracts, the zygomaticus, we smile, right? Oh, it's not, I'm sorry, I'm screwing up today. That's fine. Disregard this. We'll go back to temporalis in a minute. But zygomaticus is you're smiling. So, got ahead of myself here. Do you see this big muscle here?
Masseter.
That's the masseter. And the masseter lays right over your biggest salivary gland, which is called the parotid. And so when you chew, because this is your chewing muscle, its job is to elevate your mandible. When you chew, it squeezes on that parotid salivary gland and squeezes saliva into your mouth, which helps when you chew, right? But if you clench your teeth really hard, you should feel this muscle up here contract. Can you feel it contract when you clench? That's your temporalis. So your temporalis is a synergist of your masseter. So if you're chewing really hard, you ever chewed really hard and it hurts here? Sometimes your jaw just hurts. But those are those two muscles. We're good on those? Two big circular muscles. I don't care if anybody. This big muscle encircles your eye, and that is called the what? Orbicularis oculi. And so when it contracts, and you can feel it contracting, and we contract it a lot, and that's why we get wrinkles here, but this is for squinting. You know, there's actually, and it does help you blink, there's an actual muscle that does blinking more, but it's for squinting your eyes. Some people just say close eyelids, and some books say that, which is fine. You see this little tiny muscle here? It's a corrugator. I never pin it, but I know I put it on your lecture test. So when you bring your eyebrows in together, when you're frowning or you're concerned, that's your corrugator muscle, right? You can feel it contracting. Yes, no, you can see it contract under your skin. There's a big muscle called your nasalis muscle. It's not the best on here, but that is for
Scrunching up your
scrunching
nose.
your nose. Flaring your nostrils is your procerus. I never pin it. I usually don't pin your nasals, but I do ask what it does. This big circular muscle is your
Orbicularis
oris. And this is your kissing muscle. Pucker up, baby. Okay? This puckers your lips. They say purse your lips. So when you go good, that's your orbicularis oculi. Not really for chewing.
Oris.
Oris. Did I say oculi again? Oris. I'm doing really well today. No doubt. Now, if we tear the masseter off, underneath is a big muscle that runs sideways. And that is your buccinator, or you can call it buccinator. Either one's correct. And that's for sucking. So when you suck with a straw, or when you're a baby and you're sucking milk, you're using your buccinator a lot. And you do use it when you chew, kind of. It helps push food in there. But it's not directly involved in chewing. It's more for sucking in stuff. Right? Okay. What else? I never pin mentalis. We'll go over that in lecture. So I went over these. And then this muscle, see how it's hooked on the clavicle and the sternum? And then it goes up onto the mastoid process. This muscle here is your sternocleidoid mastoid. Okay? Now, some muscles work really hard to keep your head erect. One of them that works really hard is this big muscle here. Okay? Its origin is on your occipital bone, your cervical vertebrae, and thoracic vertebrae. And this muscle is your what? Trapezius. And the trapezius's job is to hold your head erect. It also shrugs your shoulders. Okay, when your scapula go up, that's your trapezius. What it tries to do is it tries to pull everything in toward the midsection of the back here. So it does do some elevation of your scapula. It does some adduction of your scapula. So if you stand at attention, your trapezius is engaged. You ever grabbed on a steering wheel really hard and then you tightens here? That's your trapezius. This muscle is a big generator of headaches because it tenses up, and when it tenses up, constricts blood flow, and you can get headaches. And a lot of people, that's where a lot of your tension is at, in that trapezius. So if we peel that trapezius off, underneath it, we will see this big muscle here going up. See how that goes up? What muscle is that? Actually, we pin it. Usually pin it here. Anybody know what that is? Levator scapula. It does what its name implies. It helps assist the trapezius in elevating the scapula. So if you're shrugging your shoulders, standing up, it's going to help with that motion. Then we have these two muscles here. See these two muscles here? These are your rhomboids. Remember I told you minors are usually superior? So here's your rhomboid minor, and here's your rhomboid major. We use these more than you think, and they do get sore. These are hooked right on your scapula. Cats have an extra one. Dogs have an extra one because they're on all fours. Because what these are doing, if you look at how they're positioned, they're helping to move those scapula and keep them in place. That's really their job. Right, so if we're walking on all fours, we want these to be held in place. Does that make sense? Does anybody know what this bony landmark is?
Spine of the scapula.
So the muscle on top of it is the supraspinatus. This is the infraspinatus. Then you've got this muscle here, and that is your teres minor, and this is your teres major. The rotator cuff muscles are the teres minor, the infraspinatus, and the supraspinatus, and subscapularis, which we can't see on the model. I have to pull out an actual arm for that one. Those are all your rotator cuff muscles. And so when we throw a ball, we're gonna engage various ones as we go through the whole movement of the arm, right? And we'll go through that in lecture. Biggest muscle of the back. Biggest one is which one? Latissimus dorsi. Here it is. It has a huge fascia here. This muscle, all it's designed to do, huge muscle, it inserts up here under your armpit on your humerus. Its whole job is to pull your arms down and back. That's its whole job, is for arm movement. We have two huge muscles to move the arms. Latissimus dorsi is down and back, and what big muscle pulls them forward? Pectoralis major. Is that a big muscle? Mm-hmm. Yeah, look at it. All for arm movement. But does that make sense? We need big muscles, move those arms, because these are for power. Okay? Pectoralis major, power here. Now we peel it off, and then we'll see the pectoralis minors, which aren't much to write home about. One of my favorite muscles is under here, called the serratus anterior, the boxing muscle. That helps to abduct your scapula and give you force as you punch somebody. Okay? We don't use it a lot, do we? No. You punch a lot of people? Okay, so we stay away from Brooklyn. I'm glad you have a good grade. But most people don't use that muscle much. But have you ever seen bodybuilders? They'll have huge ones and their arms can hardly go down because they're so out. Do you work those?
No, but my football coach had them and we always call them fish gills.
He was probably proud of those.
Yeah, he was.
Yeah, I can see that. All right. Deltoids, somebody mentioned deltoids. These are your shoulder pads, right? They have 3 heads. I don't get too excited about those. That muscle is for arm abduction. It inserts on the deltoid tuberosity and tries to pull your humerus up to the points of insertion up here, and that's all it can do. So they call that arm abduction. Does that make sense? Yes, no? Now my favorite are the abdominal muscles. You don't have to know that one. We have 4 layers of abdominal muscles. Okay? Again, here's your pectoralis major. Do you see how this is all white? Does anyone know what this is called? It's called the rectal sheath. The rectal sheath actually covers your rectus abdominis muscle. Okay, so this is the most superficial. The only abdominal muscle we should be able to see when we first peel the skin off a human or a cat are the external obliques. See them going up this way? Yes, no? So your external obliques, again, lazy muscle. But this, you know, we talk about building your core muscles. You're building 4 core muscles. The external obliques are one of them. Now, some people do twisting sit-ups to work them. That does work them. But you can simply, if you breathe out and suck your belly in, you should engage those external obliques. Takes a little practice, but you can do that. And those will help your back over the years. So you want to, those are the most superficial, the external obliques. If we peel off the rectal sheath, then we will see, I'm running over, aren't I? You just have to yell at me. This is your rectus abdominis. And we're going to talk why it's in these little segments, because this is really a good design. At the same level as your rectus abdominis is your internal obliques. Again, a lazy muscle, we don't work those very much. See how those fibers go? And then we have to pull this off underneath. Do you see the abdominal muscles that are going sideways? That's the lowest layer of abdominal muscles. That's your transversus abdominis. So 4 layers of abdominal muscles. Okay? And we're going to stop there then.